Hello friends, my name is Stephen.P.Ray, and as of the spring of 2022, I am a second year dental student at the University of Tennessee Health Science Center here in Memphis, Tennessee. I was born and raised in Nashville, Tennessee, and I went to a private all-boys high school where I really started to develop an appreciation for studying and writing and doing good work. I then spent 1 year as a student athlete playing lacrosse at the University of Tampa down in Florida, and this was an awesome experience. I got to live out my dream to become a college athlete as well as be in Florida, which was of course very cool. But after this year, I decided to transfer back home to the state of Tennessee, where I would spend 3.5 years at the University of Tennessee, Knoxville as an undergraduate student. At UT Knoxville, I studied English specifically, which was my major, and then I also got a minor in biology because I was really close having all of the dental prereqs. I picked English because I thought it was an interesting subject and I had always enjoyed it, and I wanted to have an application to dental school that was slightly different than the typical student. A fun fact about me is that I actually spend a lot of my free time making YouTube videos. I have my YouTube channel, Stephen.P.Ray, where I upload content about my experiences as a dental student, what I go through each and every day, how I study, and just some of the behind the scenes aspects of my life. I also have an Instagram account which kind of goes along with the YouTube account. And I do this all in my free time. I'm able to keep it up and have fun with it outside of dental school, so it's truly a pleasure. I was actually interested in dentistry from a very young age. My father, Dr. Len Ray, has been a dentist for over 42 years now, practicing in a small town outside of Nashville, Tennessee, called Ashland, Tennessee. So he went to dental school. He actually went to the University of Tennessee here in Memphis as well and graduated back in 1979. So dentistry was in my family. I was very aware of it from a young age. My dad used to come home with packages of dental materials and instruments, and he would slightly anesthetize us and he would pull our baby teeth, which was really a cool experience for me as a young kid. But I didn't become truly interested in dentistry as a profession until I went to college. When I went to college, I started to participate in remote area medical clinics. These RAM clinics are extremely amazing experiences, and at these RAM clinics, dental services are often performed by local dentists or dental students in the area. I went to one in Gray, Tennessee, and I was able to assist a fourth-year dental student in extractions. And it was this crazy, eye-opening experience where I realized that dentistry was, in fact, what I wanted to do with my future. I knew that it was my calling in that moment, and it was really the moment when I started to focus and study really, really hard so that I could eventually be accepted to dental school. So the DAT is such a tough experience overall. It's very, very scary. I remember when I was a pre-dental student and I was looking ahead at the next couple of years of my pre-dental experience, the one thing that I dreaded the most was the DAT. I wouldn't say I'm the best standardized test taker. I had to work really hard to get a decent ACT score. So it wasn't something that came naturally to me, and it was definitely something that gave me anxiety in the beginning. So to combat this, I started early. I think I started about 3 months out from my test day, and I began using DAT Bootcamp. I think DAT Bootcamp is far and away the best preparatory service that a student can use to get ready for the DAT. For me, it had absolutely everything that I needed. It covered all the sections of the DAT in great detail. It had wonderful videos. It was really well organized, and it had a schedule made by Ari himself that allowed you to follow each and every day to go through enough content to basically set yourself up for success on the exam. I would say that if you need any extra help outside of what DAT Bootcamp offers, there are books that you can get and other services, but generally speaking, you yourself, you know where you're at in your test studying, you know what subjects you're good at and which ones you're not great at. For me, math was my most difficult subject and it was my lowest score, but ultimately I was able to do pretty well on the science sections and I was able to do very well on the perceptual ability test, which in my opinion is all practice. If you can practice every day for the perceptual ability test, you will be successful. It's not something that you have to learn, it's simply a skill, and you can get better at skills with practice. Spend time studying, be very diligent, but don't get yourself overwhelmed. This isn't the end of the world. I know multiple students, multiple of my classmates that actually took the DAT multiple times and had multiple attempts at it. And it's something that's very, very doable. If you're meant to be a dentist, which I know you are, you will end up finding a way to succeed on this test. Use your resources and trust in your studying. Don't allow yourself to be too nervous on test day, and I promise you'll do really well. I think what set me apart as an applicant when I was going through the application process was the fact that I was an English major, and I sort of played that up as something that was unique about me. When I went into my personal statement, I wrote about the fact that I think communication in dentistry is a really, really important thing. It's sort of the method by which we work and the method by which we go about each and every day interacting with our staff and our patients. I talked about how my English major had allowed me to focus on communication, both written and verbal. And I really made the point that I felt I had become a great communicator in these last couple years, and I was very hopeful that I could bring these communication skills into my practicing career as a dentist so that I could be a good, ethical, honest, and great communicating practitioner that was able to convey the ins and outs of treatment to his patients. And I think this was one thing that really set me apart. It was just a good thing for me personally to talk about because, once again, it was the experience that I had. It was something that I did think I was pretty strong in, so I talked about it. I was also super honest, relaxed, and excited in my interviews. I feel like I did quite well in my interviews at the University of Tennessee here where I was accepted. I just had a good, honest conversation with the professors that I was talking with. And I think that's ultimately what you want to try to do. You want to know your application, but you want to be honest and genuine, and you want to convey how much this means to you and that you truly do want to be a dentist in your career. So after my applications were submitted, I think it took just a couple of weeks before I was invited to an interview at the University of Tennessee here. I remember I was on the golf course with my dad, and I actually got the email that I had been invited, and they asked me to go ahead and go in and see the schedule that they had and sign myself up for a date. So I quickly did that, and I believe my interview date was sometime in August. But I made it to Memphis. My dad and I stayed in a hotel, and I got up bright and early on my interview day to head to campus and to go in and start to meet people and meet the admissions committee and some of the department members. And it was a very nerve-wracking experience. You feel once you get on campus that you're being watched by everybody. You feel like this whole application process is coming to a head and you're being evaluated at every step, which may or may not be true. It's certainly how you feel in the moment. One thing that I really tried to do was to interact with the other students that were in my interview group. I think there were 10 of us in total, and I really tried to make an effort, as uncomfortable as it was for me, to just say hello and start talking to the other students, ask them how they became interested in dentistry and just sort of how they had gotten there. And I think that was a good thing because if there were some of the admissions committee members sort of watching us and making notes, they did see that I was open and honest and ready to talk to people. I was sort of a go-getter, and I would be a good member of a class. A dental class is, in fact, a unit, so you want to be a good piece of that unit. I had 2 interviews at the University of Tennessee, and both of them were each 10 minutes long, so one was academic focused and one was personal focused. And there were 4 teachers that I talked to in total. I, once again, just kept it honest, kept it open. I tried to keep myself relaxed and conversational. I also tried to make sure I was knowledgeable about the things that I had gone through and knowledgeable about the impacts that my experiences had had on my desires to become a dentist. For the interview process, the most important thing I can tell you is to be genuine. Be genuine, be open, be honest, be ready to talk about your strengths, but also be ready to talk about your weaknesses. Listen, none of us is a perfect applicant. None of us has a perfect GPA, a perfect DAT score, perfect experiences, perfect home life, perfect everything. We just don't have that. And you shouldn't be expected to have that. We all have weaknesses. We all did poorly in a class or 2. We all had things that happened outside of us, outside of school. There just are things that happen in life that we have to be able to live with and explain. And don't shy away from those. Talk about how those experiences formed you into the person that is sitting in front of the interviewers on this day. Just be honest, be ready to talk about any and everything, and try and have a good time. Try and make it feel like you're trying to build a relationship with these professors, because if you end up going to the school that you're interviewing at, they will in fact be some of your teachers that you have in your 4 years in dental school. So try early to start up a relationship with them, and your interview experience will be very, very fruitful for you. I picked UTHSC in part because my dad went here. I said that earlier. He was in the class of 1979, and I'm a very sentimental person. It means a lot to me that I could walk in the same path that my father walked in all those years ago. But that wasn't the entire reason. I really enjoyed the fact that I would be only 3 hours away from my loved ones in Nashville, down here in Memphis. That was a really, really important thing for me. I also planned to practice in the state of Tennessee, so I wanted to start to grow and build relationships here in this state from a dental perspective, so that those relationships would be able to help me, and I would be able to help the people in those relationships in the future. I think what sets UT apart from other schools, and I can't say this with certainty because I've only been to UT, but UT has a great emphasis on creating good clinical dentists. We learn basically everything there is to know, including a lot of the cosmetic sides of dentistry that make people good practitioners when they get out of school. All of us have so much to learn, and there is going to be this big learning period after dental school where we have to really learn what we're doing. But UT does its very best to prepare us for the real world of practicing dentistry each and every day, and that was something that I really appreciated. When we get into the clinic and start treating patients, our professors are going to give us a certain degree of autonomy, expecting us to know the material, expecting us to know what we've learned over the past 2 years, and to apply these pieces of knowledge to good patient care. That was something that I really appreciated, and it's something that I look forward to seeing how it affects my future as a practicing dentist. For me, the transition from being a pre-dental student to a dental student wasn't all that remarkable. I don't think I experienced any groundbreaking things in this process. I just sort of learned that dental school is more school, it's more life, and if there are things that you feel you aren't succeeding in life as a whole, those things are going to maybe affect you in your time in dental school just as they would in undergrad. I don't think dental school is markedly different from undergrad. I do think that some of the experiences that we have here are a little bit more enjoyable. They're a little bit more fruitful because we know these are the things that we're going to be doing for the rest of our lives, but it's more school. It's more studying, more test taking, more stress, generally speaking, and also there's a lot more hands-on material. We have to learn how to use our hands to perform dentistry, which is a good thing and a bad thing. It's tough at times, but it really is rewarding when you do it right. I don't think I really experienced imposter syndrome when I started out at UT. I kind of know what my trajectory is with dentistry. I know where I want to end up, and I know kind of the path that I need to go on to get there. But imposter syndrome is a very, very real thing. I've heard my classmates talk about it, talk about trying to get really good grades to present yourself maybe in the future as a great specialty applicant. That really didn't affect me a whole lot. I just kind of went day by day, studied what I need to study, learned the things that I needed to learn in lab, and got through it all. And also YouTube really helped me with the process because I was able to get all of this out onto physical media and present it to all of you in videos, and that has been something that's very, very special to me. The typical day of a first-year dental student is going to completely vary depending on where you're in school and kind of what your school is doing, and also which part of the year you're in. But generally speaking, you're going to have some element of lectures where you're actually going to lectures just like you would have in undergrad. You're learning material. Most of it in the first year is just purely science-based, a lot of biochemistry, histology, and some of these basic sciences, gross anatomy as well. So you're going to lectures, you're learning material in whatever way works for you, and then you're also going to have some element of hands-on work in your labs. The first semester of dental school is generally going to be the time when you learn dental anatomy, you learn the anatomy of each and every tooth in the mouth, and you also start with the foundations of operative dentistry, which are some of the more, I guess, quote, simple aspects of practical dentistry. So the typical day is going to have some element of lecture courses, didactic work, and then lab courses. You're going to have some studying to do, most likely, and you're going to have free time. And this is something that I don't think a whole lot of people talk about, but yes, we do in fact have free time in dental school. It is the reality of the situation, and you can use that free time to do with it whatever you please. I know a lot of classmates that have plenty of different hobbies, and it's a plethora of different interests and hobbies, which is super, super cool. I, like I said, use my free time to make YouTube videos and to talk to all of you, which I truly enjoy. I think what makes me most excited about going to my school is knowing that I'm going to school now to become a dentist. When I was an undergrad, I felt all the time that the entire purpose for my being in undergrad was a stepping stone. I wasn't there to actually get a degree necessarily. The things that I was learning weren't going to be applicable to my everyday directly. But now that I'm in dental school, I know that each and every day I am learning dentistry, and that's really, really important to me. It's something that I'm becoming very, very passionate about, and I'm excited to see how these years impact and affect my future as a practicing dentist. Not every day is easy here. I'm not saying that it's all sunshine and rainbows as I walk onto campus. There are days when I don't want to do it. There are days when I'm down. But generally speaking, I'm just super excited, happy, and blessed to be in the position that I'm in. And I'm very, very excited once again to see how my future folds out and just to see what practicing dentistry is like, because we spend so much time looking ahead to it. That's what excites me about going to school, and I think each and every one of you will feel that as well when you go to dental school. My biggest advice for pre-dental students has nothing to do with dentistry. It's pretty simple. I ask each and every one of you to try and enjoy your life. You only get to be young once. This period of time in your early 20s, it only comes around one time in your life. And I think that it's very, very important to enjoy it. Make it fruitful. Make your relationships last. Make them strong. Make sure the foundations of your relationships are stone, rock solid, and not sand, because those are the relationships that hopefully you will rely on and put time, effort, and energy into for years to come. Make sure you're enjoying friends. Make sure you're telling your family that you love them. Focus on making yourself a better person. Focus on getting into better shape, reading more and looking at your phone less, doing things that will positively impact your life right now and moving forward into the future. Dental school isn't necessarily the time to start trying to be a better person. You want to, if possible, build good positive habits that will positively impact your life when you're a pre-dental student, because generally speaking, you're going to have a little bit more free time as a pre-dental student. So let your pre-dental life be fruitful. Please don't get too concerned, too worried, too upset by the prospect of dental school. I am someone who believes that if it's meant to be, it's meant to be. And that's a really good thing to kind of think and believe, because you can do your work. You can do your side of the equation, but ultimately, if it's meant to be, it's meant to be. Have passion for what you do and let that passion reflect outside of you to the world around you so that other people can be positively impacted by what you do and the way you live. Guys, thank you so much for tuning in to hear me answer these questions. I hope I gave you some sort of piece that will be helpful for you moving forward. If you want to contact me, I think the best way to do that is actually through YouTube. So hop on to one of my YouTube videos. It doesn't really matter which one it is. And just leave me a comment, a question, whatever it is that's concerning you. My YouTube, once again, is Stephen.P.Ray. That is my full name in all of its fancy glory. It is what it is. I also do have an Instagram that's Stephen.P.Ray.dentistry. People leave me messages there from time to time, but I have been known to be absolutely horrible at checking my Instagram. So once again, YouTube for me is the thing that I spend more time with. It's the thing that I'm more passionate about. So if you do want to reach me, that's probably the best way. And genuinely, one of my major goals with all of this social media stuff is not to present myself as someone who's super special, someone that needs to be looked up to, or someone that needs to be glorified in any way. It's truly just to help you guys. I want to help the next generation of dental students, and moving forward, when I'm a dentist, I want to help younger dentists with the transition process. All of this is in hopes to help you. So let me know if you have any questions, any concerns, and maybe I can offer some help and have some answers for you. Thank you guys again so much for listening. I am Stephen once again, and best of luck with all of your pre-dental life. You're going to make it. I promise you.